Good morning. My name is Todd McDonald, and I'm the president of Aisling Partners Insurance Brokerage in Worcester, Massachusetts. And I am joined by Gary Fraden, president of the Medical Guide. And we're delighted to have you here this morning in our next streaming live series on healthcare reform. This morning, we're going to spend some time talking about consumer engagement. What does it mean? What is it? How do we as brokers and advisors engage in better consumer engagement with our clients? So welcome, Gary.
Hi, Todd.
Delighted to be here. You know, as I take a look back in time and think about consumer engagement and the notion of consumer-driven health plans and so forth, you know, what is it? 10 years ago, we had high-deductible plans and the introduction of them. And
CDHC, yes.
CDHC, the acronym.
Yes.
And,
right.
You know, I think that was the beginning of consumerism.
Yes.
I think the challenge was, you know, the lack of data, the lack of information, and so forth. So, Gary, in your mind, you know, what is consumer engagement?
Great question. You started off with a hard one. I think consumer engagement means helping healthcare consumers, patients, your clients, make healthcare decisions, medical decisions, the same way that they would make car buying decisions or refrigerator buying decisions. Use the same types of criteria, ask the same questions, and bring all the skills that we have developed as a society that makes us great consumers, bring all of those skills to medical care. I think we'll have tremendous benefits both for the patients and for healthcare costs. So I'd say consumerism in medical care means the same thing as consumerism in automobiles and other products.
And in automobiles, obviously, you know, for those of us buying a new car, you can go online, you can research, you can find out what a dealer paid for it, the markup and all of that. I think the challenge that we've had historically in healthcare is the lack of transparency of information and cost and quality. So I guess let's talk a little bit about that. What you say seems to be accurate, seems to be straightforward. It makes sense to myself and the role that I play, and I'm sure many that you know, are certainly watching this today. Why is there such a challenge to make it happen? What are the barriers to entry or engagement when it comes to, you know, this type of consumerism?
Barriers to entry, tough question. There are, I think, probably lots of barriers to entry. The one that strikes me as most significant is the fact that we have relatively lousy outcome data about medical care. We simply don't know what works well, what works badly, and exactly how well it works. So it's like buying a car if you don't know the miles per gallon. Maybe we can get some pricing data, but if you don't know, if a car dealer tells you gets good gas mileage, does this mean 16 miles a gallon or 41? Mm-hmm. And in medical care, we hear things like, oh, that's a risk factor for having a heart attack, or that's a risk factor for cancer, and this is a good treatment. Well, how much of a risk factor? How good of a treatment? And how will it affect me? Those are the questions that I think we have to, we're increasingly starting to focus on, and we're getting some data to help us get those answers.
And what's interesting is, you know, for the role that, again, I play with our clients and so forth, a lot of consumerism and engagement and all of that, you know, really plays around product design. Yep. And so the carriers, as you so well know, over the last several years, have really created new products designed to engage the consumer. You know,
right.
Historically in the Northeast, we've been engaged and we've been insulated from the notion of deductibles and co-insurance, right, and things of that nature. And so those are in place today.
Right.
And we have products now that require employees to make decisions, to understand, you know, where providers fall within certain tiers,
right,
limited networks and all that. So from a product standpoint, there's this notion of consumer engagement, working with the employers and with the employees to understand product and so forth. From your perspective, and what we want to get into the depths is, you know, beyond all of that, beyond product, beyond where do I go, what hospital, and so forth, you're talking in many ways about consumer engagement at the physician level, the choice level. Is there an overabundance of prescriptions and prescribing and unnecessary medical care? Let's talk a little bit about that from your perspective.
Yeah, let me make a couple points because you're raising critical ideas here. One is that researchers estimate, lots and lots of studies, that we waste up to a third of all medical spending on unnecessary care. The lowest range estimate of waste is 20% that I've seen from Donald Berwick, who ran Medicare until a few months ago. The commonly accepted estimate of waste is, quote, up to about a third. That estimate hasn't changed despite plan design changes. We're still wasting up to about a third. My comment about plan design is that we have, carriers and regulators have tried to organize our healthcare distribution system to be more efficient and cut down on unnecessary care through iteration after iteration after iteration over the past 20 or 30 years. And we have always seen healthcare inflation run about double CPI or double the rate of GDP growth. We haven't seen that fall significantly despite plan design changes. I don't know that this is a regulatory issue of reducing unnecessary waste. I don't think it's a plan design issue, although high deductibles seem to have some impact. I think the way to reduce unnecessary spending is to educate the workforce, educate the consumers, educate the patients, and show why it's in their interest not to get care, unnecessary care. It doesn't benefit them, might hurt them.
So let's talk a little bit about that. So, we provide advice and guidance to clients. We do it at the employer level, the employee level. There's benefit communication meetings and so forth. From your perspective, what are the tools and resources available? What can those who, are watching today and what have you, what can they bring to a particular client or prospective client in terms of tools and opportunity to engage, consumerism at a completely different level outside of product, outside of plan design?
I think that those tools are being developed. And there are several good ones. We're starting to get the data. We're starting to get the information about quality because nobody wants to buy bad quality. Forget price. I have yet to hear a parent saying, times are tough, we're buying cheap, really cheap, lousy medicine for our kids. I haven't heard that. I always hear parents say, I don't care what it costs, I want my kid to get the best care he can get, right, or she can get. One tool that we've been working on a lot is called the number needed to treat. Teaching consumers to ask their doctor, what's the number needed to treat with this medicine or this medication or the screening test? NNT simply tells you how many people have to have a medical procedure or take a medication in order for one person to benefit.
Okay.
Simple example.
How about cholesterol? Is there an example?
Sure, I can
throw that
tell
out
you
there?
about cholesterol. Lots of people think that cholesterol leads to heart attacks. Study after study after study has suggested that of people with high cholesterol, using all kinds of different definitions, these are generally industry-funded studies. If you have high cholesterol, about 3 people out of 100 with high cholesterol have a heart attack over the next 5 years. About 3 out of 100. This is folks who don't have heart disease. If you reduce your cholesterol with a statin, you bring that number from about 3 having a heart attack out of 100 to about 2 having a heart attack out of 100. In other words, you have to give 100 people a statin for about 5 years to avoid 1 heart attack. The number needed to treat is about 100.
Okay.
Let me make 2 points going in 2 different directions here. Some commentators have suggested that insurance not pay for interventions that have a number needed to treat greater than 20. 20 means only 5% of the people benefit. So if you learn the number needed to treat, you can learn how efficient or how effective this medical intervention is. Then you can choose. The sister, or cousin, if you will, of the number needed to treat is the number needed for harm.
Okay. NNH?
NNH. Now, and obviously that tells you how many people have to take the medication for one person to report a harm. Let me tie all this together and refer to what Dr. David Newman of Columbia Medical School, he's one of our advisors, claims. Knowing the number needed to treat and number needed for harm is basic medical literacy. If you don't know these numbers and you can't discuss them, then you're medically illiterate. It's sort of like an accountant saying you made money I don't have any idea what your earnings per share was. I don't know how much you made.
So is your expectation that individual consumers should know their own NNT and should know these facts and be able to go into a physician? I guess I'll use myself as an example.
Okay.
I happened to have 2 days ago my annual physical. And I went in, and you have your 12 minutes of time, if that. And, part of the discussion was, ironically, around cholesterol. And there's been a lot of articles and publications about cholesterols and statins and the danger of them and so forth. And,
right.
I thought I was being a good consumer, and I thought I was engaging by simply asking my doctor and challenging the notion of whether or not I should remain on a statin.
Right.
And the comment that came back was, the belief still is that the rewards of being on a statin outweigh the risks. And his comment further was developed by him stating, if it's of any help, Todd, I too am on a statin and have been, so I would not be prescribing something to you that I myself am actually not engaged in taking. So, from my standpoint as someone who's in this industry and does what I do, I felt as though I did become a better consumer. I did engage the process more by asking some questions and actually challenging the notion of remaining on this and the risk versus rewards. I'm not sure many people take the step that I took, but I get the sense from our discussion, certainly, there's more to do and there's more questions to ask, and that maybe I should be armed with NNTs and NNH and so forth. Is that?
I think so.
Okay.
I think the overriding lesson from your story is, if you're comfortable with your doctor, do what your doctor says. I think I in no way want to make people uncomfortable. That is dysfunctional all the way through. But your doctor may have different risk tolerances from you. He may have different orientations. He may or may not exercise the same as you. He may have all kinds of different risk factors. And his decision may not be the same as yours. To some extent, and I don't want to belittle doctors, I'm not, but to some extent, when you go buy a used car from a fellow who has lots and lots of really good, high-quality used cars, and you look at a Ford Taurus, you say, "Oh, I drive a Ford Taurus." Okay, but I don't know how you made your decision. I don't know how your doctor made your decision. That's why I think asking, what the numbers are, and going in to a discussion. Remember, doctors learn how to calculate the NNT, the number needed to treat, and the NNH. They learn this in medical school. But they don't talk to patients about it because they figure that in 12 minutes they don't have time to teach this to a patient.
Sure.
But if you go in and ask the question and say, I will take a medication that you prescribe, but I want to know the NNT. I want to know the number needed to treat. I want to know the number needed to treat for 2 or 3 different options, and then I want to choose the best. And I don't want to take a medication if you don't know how well it's going to work for me. That's how I would offer to challenge it.
And I like it. And I truly do. The question is, how do we get consumers to be willing to take that step, to have the comfort and the confidence to be able to challenge their physician, question their physician, and I don't mean that in a negative or derogatory sense, but to give them the comfort and the confidence. Is there data? Is there statistics? Is there any tools and resources where I could, prior to having gone to my physical 2 days ago, are there any resources that I could have reviewed or any tools I could have evaluated to make me a better consumer and a better engaged consumer by asking particular questions?
Well, sure, we have a website that does this. Let me go through 4 simple questions that we sometimes suggest that, I don't know how to do it. Okay, here we go. Question number 1. Out of 100 people like me, how many will have the bad event? 100 people like me with high cholesterol, how many will have a heart attack? Ask the question. The statin example, we said about 3.
Yes.
If your cholesterol level is 350, it might be 4, might be 5. If your cholesterol level is 202, it might be 2. Out of 100 people like me, how many will have the bad event? Question number 2, Doc, you're suggesting that I do something. If I take the medication, if I have the screening test, if I have the medical intervention, how many people, out of 100 people like me, how many will still have the bad event? Because we know that medicine doesn't work perfectly 100% all the time. Question 3, how many people actually benefit from taking the medication?
Yes.
Get the number. Out of 100 people like me, how many benefit? And question number 4, out of 100 people like me, how many are harmed? When you get that information, and here's our slide of the four questions, if you want to review them. Simple questions. You would ask this of a car dealer in a different form. You would ask this if you're buying a refrigerator. You would ask this of many different products. Ask.
I think that's the key. When you say ask, we're a society who has just taken advice, taken whatever's said by our doctor, trusting it, doing whatever is prescribed, if you will. And I think we are at a day and an age where it's so complex, and for many of you who are watching this today and are in the advisory role in the benefits world, the complexities are just so great.
Absolutely.
We're back to product, we're back to tiers, we're back to networks and HRAs and FSAs and MSAs and,
Yep.
and so on and so forth. And for many of us, and myself included, when I think of consumer engagement, I think of doing a better job of educating the consumers on product and product design.
Yep.
And to make sure that they become better consumers at time of service.
Yep.
And I think that notion is critically important, but I think secondarily there's a combination here of saying, that is one form of consumer engagement. I guess as we get back to what is engagement, what is consumer engagement, one form of it is certainly a product and an education and an understanding of how the policy that you have works.
Yes.
This is a completely secondary piece, although I think interwoven,
Yep.
to suggest that you need to ask questions, you need to understand
Yes.
medically
Yes.
what steps need to be taken. Is that?
Right, and let me turn this into a question for you.
Okay.
If you think that someone in this high-deductible world where people are starting to spend their own money, so they're interested in spending their money more wisely, gives you the opportunity to spend the money, but somebody has to educate them about how to spend the money. Where in our healthcare distribution system does that entity lie? Is it physicians? You have 12 minutes. Is that the right area? Is it the hospital? Are they going to teach you which questions to ask about your medical care? Is it the carrier? Problem with the carrier is we all know why a carrier would tell you about unnecessary care. They want us to make money. Is it the employer? It's probably pretty busy making widgets, especially during a recession. They don't have a lot of extra resources to teach. Where in our healthcare distribution system, medical distribution system, is there an entity who can take on the responsibility of doing this teaching to address that 33% waste factor, besides the broker?
And I don't think there is. And I think that's the honest answer, is that all of the stakeholders, all of the people involved in the process, none of them have the ability, the bandwidth, in many ways the time to do that. And I think you make a very valid point. It's just an interesting dynamic. For 20 years I've been in the business, and you provide advice and guidance and counsel to employers and more to employees, and the notion of wellness, which engages a whole different element to all of this. But all of a sudden, here we are in the role that we play, and again, for many who are watching today, thinking about education and engagement at a completely different level. To talk about, understanding your NNTs and NNH and what questions to ask your provider, and so on and so forth. It's a completely different way, and a completely different approach, at the same time, critically important.
Let me ask you a question now.
Please.
You said this is that at your physical a couple days ago was the first time you pushed back and you challenged your doctor.
Yes.
Why? You've had a physical presumably every year for many years. Why?
Yes.
What happened this year?
I think a little more knowledge, a little more understanding. Certainly, the likes of folks like you and so forth. It's one of those that where news and information, where transparency of information is becoming greater. And I don't simply want to take the status quo, as many of us always do, in terms of you're prescribed something, you take it. That's just the way it is. And I think the notion of statins and harm and long-term effect have really resonated with me and caused me to push back on that particular item. But I think in general, we can all agree that our healthcare system is flawed.
Yes.
At many levels. You mentioned waste before, and 30% waste. Above and beyond all of that, for me to go in once a year for my personal health and literally have about 12 minutes to ask questions, receive information, review data, and all of that, to me is challenging and troubling.
Yes,
and so
I think so.
I need to become my biggest and my own advocate for my own health care. And I think, getting back to your original question, why this year? I think it's because more information is available. I think we are changing, and I think there's really a dynamic going on in our industry where we need to challenge. We need to be, in the role that we play, providing advice and guidance beyond product, beyond solution, beyond all of that, and provide advice and guidance at the employee level.
I think it's really interesting when you make the point about more information becoming available. I think that resonates with me, that more and more information is becoming available to consumers. And I think we run the risk of having information overload. The question is, what information is really useful? What information is bogus or biased or not terribly useful? How does a consumer figure that out?
Gary, that's a complete struggle for me, I'm sure for just about every consumer. What is the right information? If I read the Harvard Business Journal, there's one piece of information. You read another article, you read another book. It's very challenging to understand, what information is accurate.
Yep.
From which stakeholders does this information come from, and is there any bias? Is there any connection back to any type of, provider or maker of prescriptions or what have you? So maybe I can turn this back to a question to you: is, as a consumer, how do I navigate my way through the various information channels to arrive at what I think is good, solid, accurate information, so that I can make good, solid, accurate, personal choices?
And I think that's the question that resonates with me, and that highlights the broker's role. I don't think that a broker can give medical advice. Clearly, a broker isn't licensed. And the broker can't say, here is a procedure that works and here's a procedure that doesn't work, according to some study. That's not really the broker's role. It seems to me that the broker's future role and the growth of this whole part of our business is teaching people the questions to ask. If you ask the right question, you have a pretty good chance of getting the right answer. If you don't ask the right questions, then you may get all kinds of misinformation or confusing information or biased information or some other problem. We try to simplify this by asking the 4 questions. Out of 100 people like me, how many will be harmed? Out of 100 people like me, how many will benefit? And we try to simplify it by having people learn to ask questions about the number needed to treat. I guess my feeling is, if brokers can put on consumer engagement programs, courses, whatever, for their employees that help people ask the right questions, then we've gone a big step. We've made progress. And step 2, I can't tell you about yet. I don't know what it is.
But I think back to your point is, when you have the stakeholders, the providers, and you have, various folks as part of the equation, who is best served to do it? I guess, for someone who's been 20 years in the business, I have an initial challenge internally to think that I am the one, and my firm is the one to provide consumer engagement at a level that gets so specific to medical care and so forth. At the same time, you can see the validity to this in that many of us simply can't hide behind the notion that consumer engagement is teaching and educating on product.
Right.
And all of the elements that go along with that. And so it's just, but it's a challenge, and it's a shift.
Do you think, as a business owner, you can avoid getting involved in this kind of consumer education?
I don't.
No.
I truly don't.
No.
The question is when, how quickly, how broad of a spectrum, how deep,
that's right.
And that's a challenge. So I say it openly that, it's really a shift. It's a mental shift to think of the role that we play and how we will, engage the consumer at a completely different level. At the same time, tremendously exciting. And then beyond all of that, and maybe we can chat a little bit about this, the complexities to everybody. As we sit in the role that we play as employers and employees, you have new products with all sorts
Right.
functionality and all sorts of limitations in terms of tiers and networks, and as I said before, a lot of the account-based plans, so the HSAs, and it has become so complicated. Beyond all of that, let's talk about the role of the government and their desire to play in this particular space, particularly the 1 to 50 mark, and we're sure that will rise. Their desire to have a distribution channel in a state for which we have the highest penetration of insured rate. So my point being is the complexities at the product level, at the distribution level, is just immense and enormous, and then you fold in another whole component and layer. And I guess trying to understand how we articulate it and taking it back to the role that we play, how do we do this? And what is the first best step for us to do it? And I guess I put that as a question, or at least a kind of a thought-provoking.
I think it's thought-provoking.
Yeah. And
I don't have an answer. As you were talking, I was thinking about that famous Chinese curse or blessing, may you live in interesting times.
Yes.
Yes, it is tough to navigate. Look, it's always tough to navigate. It's always tough to run a small business. I guess the first step I would suggest for brokers who want to get into this sort of brave new world is to become familiar with some of these consumer aids, decision-making aids, medical decision-making aids, to become familiar with this part of the business, and then on a case-by-case basis work it in. I wish I had a better and more complete answer.
No, but I think I think that your answer is representative of where we're at in the stage of development of this, and I truly do.
Oh.
One of the things that comes to my mind, and I certainly want to garner your perspective, is this notion of cost and quality.
Right.
And it's at times such a nebulous thing, where many of the carriers, going back to the product designs and so forth, and consumer engagement at the product level, is cost and quality.
Yes.
Your thoughts on cost versus quality, the importance of it. Is cost a real driver and issue, or do you believe quality prevails and someone's going to provide and ask for and request and require quality without the notion of evaluating cost?
Good question. Let me, I think transparency is clearly both. You have to know price. You don't want to get the same quality for $2,000 that you could buy for $600.
Sure.
We know this. But I think that the first step, the driving force, is quality. Everybody wants the best medical care they can get for themselves. One of the reasons that so many people use expensive hospitals is because we equate high costs with better quality, or high credentials with better quality, or university medical school affiliation with better quality. I think people want quality. Then, if you find two procedures that have the same NNT and the same outcomes, sure, then go for the least expensive one. But I would hesitate to, or I would warn people against assuming that you can learn something about the quality from the price, because you can't. A broker once said to me, this quality information is too complicated. If we assume the quality is all the same, then you can shop based on price. And my response was, besides that, Mrs. Kennedy, how was your trip to Dallas? I heard you had a nice breakfast. The ball game is quality.
Right.
And price is a secondary consideration. We discussed this actually in the last video here, that I have not yet met a person who wants poor medical care, and I have yet to meet a person who wants inexpensive, unnecessary, and wasteful care. I only meet people who want good, necessary care.
I think you bring up a great point, and I think the challenge that we see every day is that also the waste in care. People never want bad care; they want good quality. But I think it's the waste, and it goes back to that 30%. It goes back to kind of how the system is currently structured, and I think that's a tremendous challenge. Again, getting back to the complexities of it and so forth, but waste continues to be an issue, and so forth. Back to kind of these 4 questions and that type of a thing. Is this something that, I look at the Northeast, I look at how we have been slow to engage consumerism.
Right.
When California had 80/20 plans and high deductibles, we were still first dollar and so forth.
Yep.
This concept that, we need to engage deeper, we need to get involved in asking our physicians and knowing the questions and understanding NNTs and so forth. Is this a regional-based thought? Is this a national-based thought? Is it an international-based thought? In other words, is it how our healthcare is structured here and this type of approach needs to happen? Is it something beyond the boundaries of our state?
I think all healthcare consumers in all countries have the same questions. Mm-hmm. I think all parents want good care for their kids. All sick people want good care for themselves. And if you're in a government-funded system or a privately funded system or a mixed system, you as the consumer still have the responsibility for asking the right questions and getting the best care for yourself. So I don't think the structure of the system matters. I think people are all the same. They all want good care. And research is being done on all of these different kinds of metrics all over the world, with researchers having the same fundamental question,
sure,
which is how can we identify good, high-quality, necessary care as opposed to poor, unnecessary, low-quality, wasteful care. Everybody's interested in the same thing. My guess would be that there will be an explosion of knowledge on this whole quality arena, over the next decade or so. The early adopter brokers who start
sure
to educate their clients now, start to learn the programs now, start to learn what this is all about now, will put themselves in an awfully strong position as all of this evolves to capitalize and grow their businesses in the future.
I think it's a great point. And again, for those, those watching, I think it's something that we need to be mindful of and to know that, we have been and continue to be moving away from product-based sale,
yes,
product-based advice and guidance, and becoming, a true consultant and a consultant beyond all of that. And, I think it's a tremendous opportunity personally for those who are willing to engage. It is exciting. It's tremendously exciting.
It's exciting.
The question is, we as brokers have a role to play, and I want to go back to a point you made earlier. We as brokers, I think, have a very big role to play, and I think a unique one, and I think we can capitalize on that. Mm-hmm. The other stakeholders that we don't believe are equipped to participate, my hope is that changes at least in some capacity, because we really need them to be part of the equation in some way, shape, or form. Do I expect it's going to be my doctor who's going to be coming to me with an NNT and all of that? No, but I'd like to believe that the other stakeholders will engage this at some level so that it becomes a collaboration versus, one unit, one peg of the stool, if you will,
sure,
understanding it and learning it. And so the hope and goal would be, that.
Yeah, I would agree with that, yeah.
So, I think, been a tremendous dialogue.
Yeah, it was interesting. Yeah, good questions.
Well, thank you. And, for those of you who have been watching, hopefully you found some value in this. We have this consumer engagement. It takes on a tremendous spectrum of what it means, what it is. For most, it has been historically something about product and how do we engage consumers in product and understanding and how to best utilize the plan that they have chosen. But today with Gary Fraden, it's really been about taking it to a different level and really getting to the medical aspect of consumerism and consumer engagement, asking questions, understanding, and so forth, a completely different aspect to the, to the world of healthcare as it stands today. So my hope is you found some value in this program. Gary, thank you for your time, your comments, your insight, and we greatly appreciate that. And we welcome you to join us again at the next streaming live series. So Gary, thank you again.
Thanks a lot, Tom.
A pleasure.
Enjoyed it.
Thank you.